Hi, everybody. This is Dr. Dawn Moore from Expression Seminars and Expression Speech Language and Myofunctional Center in Burlington, North Carolina. Excited that you're here. Today, we are going to talk about orofacial myology. And I am a certified orofacial myologist, which means that I have gone through a very rigorous training process and certification process to obtain this certification. And the things that we work on in orofacial myology include resting postures and opening up the airways. So we work on things like getting the tongue resting on the roof of the mouth or the palate. We work on establishing nasal breathing and closing the lips. And so those are some of the things that we really focus on to make sure that the face is developing right, especially for children. Or we work with adults who have chronic lifelong conditions like jaw pain, headaches, mouth breathing, sleep apnea, those kind of things. And we work with them to establish good resting postures and strengthen the muscles that maybe have been weakened over the years of not having them rest appropriately. And we work with them to get them normalized so that they have a better quality of life. Some of the things that one of the overall writing factors for us is airway. And that is one of the areas that we have to assess to determine if they have what is known as a patent airway, meaning that they can breathe normally with the lips closed, breathe normally through the nose, and that they're getting a really good oxygen level. Obviously, we don't measure oxygen levels, but for a lot of our patients, when they come in, we can tell if they're breathing well because of how the face is developed. If the face hasn't developed well, it's typically because of a breathing issue, or maybe some other kind of thing like a sucking habit, or pacifiers, or thumb sucking or finger sucking, or maybe they're breathing through the mouth. And we see a lot of problems with mouth breathing, where if you leave your mouth open for a long period of time, the tongue has to fall to the floor of the mouth to be able to open up the airway, open up the throat. And what we end up seeing is then we lose this lip strength, we lose the cheek strength, the jaw strength. We just lose all of these muscles in the mouth, and the tongue doesn't maintain strength either and stay on the roof of the mouth. So we lose a lot of this muscle strength when we just walk around because we have to breathe that way. And so what we try to do is we work with them, one, to help them get to the ENT that they need to see to fix the airway problems. And then we work on habituating normal resting postures, which is lips closed, tongue on the roof of the mouth, and breathing through the nose. So there's a lot of things that we have to do to get to that point, a lot of areas that we have to assess. But overall, those are the three things that we are looking to correct. As I said, this is a subfield in speech language pathology. It just requires a lot of training. Once you do start down this road, you will find that the training pretty much never ends, kind of like our SLP field as well. But it's exciting because even though it's been around for 50 plus years, the information coming out is just amazing right now. And sleep medicine is really, and ENTs are really putting a lot of information out there. And then of course, our dentists, who have really been pioneers in the field and leading us down this road, as dentists were tasked with sleep health a couple years ago by the ADA to determine if patients who are coming in, especially young patients, are having sleep problems. And they are typically the first people that can identify them if they aren't already seeing a speech language pathologist who knows about these types of things. So we're excited that this field is here, and we hope that maybe you're interested in learning more. To do that, we will put some information in the links, like www.iaom.com. We will put links to our website at expressionspeech.com, and Expression Seminars, which we have some on-demand seminars for ASHA CEUs to learn about orofacial myology and tethered oral tissues, which is AKA tongue tie and lip ties. So there's a lot of information out there, and we're hoping that this will spur you on to find out more about this exciting field and join us in getting this information out to the public so that we can create healthier children and healthier adults. Hope to see you soon. Bye.